Hello, this video is to describe the use of ultrasound in assessment of abdominal and thoracic trauma. This is the FAST technique, or the focused abdominal sonography for trauma. We'll take 4 views of the abdomen and chest to rule out the presence of fluid within the peritoneal or pericardial cavities. To do this, we'll be using the Sonography Micromax machine. When the machine is brought to the trauma bay, it can be plugged in to outlets underneath the resuscitation bed. The machine is turned on with this button. The probe that is used is the phased array probe. During fast ultrasound, it's important not to drop the transducer on the floor, which can destroy it. These transducers are worth about $10,000 a piece. Also, be careful not to hook the cord on the wheels or trip over it with your feet. Pulling the cord out of the attachments, the connectors, or the probe will also destroy the probe. After turning on the machine, make sure that the correct date and time are shown on the machine. The patient's name should be entered by pressing the patient button. Enter the patient's name and MRN. When done, hit the patient button again, or the done button. Now the patient's name is displayed on the screen. Make sure that proper time and date is indicated. Make sure that you're in general mode and that you're not in THI or any other special modes to start the ultrasound. The phased array probe makes a pie-shaped type image on the ultrasound machine. The green dot indicates the position of the index. Therefore, to orientate yourself, the green dot is aligned with this bump on the transducer head. The first view is usually of the pericardium. This can be placed at just below the xiphy-sternum, and with adjustments in gain and depth, a view of the heart and pericardium can be attained. The view is through the liver, and so the objects seen on the ultrasound will be the liver, the diaphragm, pericardium, ventricle, and the remainder of the heart. If the view obtained from this position is not satisfactory, another view can be attained of the heart from a parasternal window. And here we can see the septum between the ventricles, the valves, and the pericardial space, which in this case is closed. The next view is taken in the right upper quadrant, looking at Morrison's pouch. Here we're attempting to see the interface between the kidney and the liver. You may have to slide, tilt, pan, rotate, or translate to get a view between the ribs. Here we see the liver, which is this gray object, the kidney, the bean-shaped object, and Morrison's pouch is this area here. In this case, the study is negative, as we do not see a wedge of black fluid in Morrison's pouch. Next, we look at the splenic fossa. This requires you to reach across the patient. And again, those black bands are ribs, and to get around them you have to pan, tilt, rotate. And here we have the spleen on top of the kidney, and we can see no intervening black band in between, indicating the presence of free fluid. The final view is of the bladder. This is done in 2 projections. First transversely, and the bladder is this rectangular object seen in the pelvis. If it is too empty because of the presence of a Foley catheter or prior voiding, it can be inflated by inserting saline via the Foley catheter. A longitudinal view should also be taken. The urine within the bladder is black, but if you see black fluid outside of the bladder, this indicates fluid within the pelvis. After completing the ultrasound, there are still 2 more tasks to be done. First is documentation. You must either dictate or write a progress note describing the findings of the ultrasound. In addition, you must also fill out an ultrasound QA form, which is found within the ultrasound log kept on the bottom of the ultrasound machine. These forms are used to do quality assurance and to log ultrasound. This is important if you want future credentials in ultrasound. For the FAST, indicate the indications for doing the findings on the QA form, any findings that were indicated, questions for the QA committee, and the presence of free fluid.